This episode is brought to you by ProMensal.
I often have women come to me because they think I can help them with leaking urine when they cough and sneeze. But what they don't realise is that what's related to that leaking urine when they cough and sneeze might also be impacting other areas of their pelvic health.
Welcome to Thriving in Menopause, brought to you by Prevention Magazine. My name's Andrea Duval, and did you know that more than 1 in 3 of us have some form of bladder leakage? It's no laughing matter, especially since laughing is a massive trigger for these embarrassing little accidents. So today I'm joined by Caitlin Dunsford, who's a women's health physiotherapist, to chat about this. Hi, Caitlin.
Hi, Andrea. Thanks for having me.
Really, I want to know why. Why does this start to happen?
Oh, you opened a can of worms to start with, right? I think it's surprising. I think obviously it's most surprising that how common it is. You mentioned already that 1 in 3 women are experiencing bladder leakage, but I think what is most surprising to women is the amount of reasons or causes behind urinary incontinence. There are so many life stages or risk factors that can impact or make you more likely to experience bladder leaks, the most obvious being pregnancy, childbirth and menopause. But the least obvious and the not so well-known risk factors for leaking or bladder leakage are things like weight gain, chronic coughing, some medication use, constipation, some forms of exercise. And if I take all of that list that I've just mentioned, that can happen to anybody at any age, right? So it's no wonder it's so common.
So let's talk about midlife and why it tends to happen as we get into our 40s and 50s.
Yeah, there are a lot of reasons because as we get into our 40s and 50s, there's lots at play. If I talked about those risk factors already, some things being weight gain, some things being chronic constipation, chronic coughing, some lifestyle diseases like diabetes or medication use can make you more at risk. And all of these things are more likely to happen as we age for lots of different reasons. But the biggest trigger for urinary incontinence in mid-age is going to be changes in estrogen production and usage. So the most obvious being with perimenopause and menopause, you have that reduction in estrogen, and that's just to oversimplify it. But that's going to impact your contractility, so how well and strongly your pelvic floor can contract. It's also going to affect how easily your bladder can stretch and collect and store urine until you're ready to go to the toilet. So that's the biggest impactor in that midlife.
So it sounds like it impacts your bladder in the same way that all your muscles sort of tend to atrophy a little bit as you age. Is that what you're saying?
Yeah. So the wall of your bladder is a muscle.
Right. How bad does it have to be for women to come and seek treatment? And, I guess there's a difference between having a little whoopsie moment when you perhaps sneeze every once in a while and something that starts to happen more regularly. What do you tend to see in your practice? What's not abnormal is my question.
Yeah, I think leaking at any stage is something that you can definitely benefit from seeing a physio from. And sometimes the leaking once when you cough or sneeze is the tip of the iceberg, and there's lots of maybe poor or suboptimal bladder and bowel habits that sit underneath the water that you can't see that can be rectified or improved with physiotherapy, women's health physiotherapy, because I often have women come to me because they think I can help them with leaking urine when they cough and sneeze. But what they don't realise is that what's related to that leaking urine when they cough and sneeze might also be impacting other areas of their pelvic health. So they might be having pain with intercourse. They might be chronically constipated. They might have trouble using a tampon, or if they're postmenopause, they might be having vaginal dryness, and it might be impacting, they're not sure how to exercise, or it's impacting their desirability to exercise. And as a women's health physio, we can have an impact and improve that quality of life for all of those areas. So I always say to women, you don't need to wait till it's awful, till you're leaking every day, all day, and spending half a paycheck on incontinence products. If it's bothering you now and it's impacting your day-to-day activities, see somebody. Likewise with prevention, right? That's the name of the game for you. But if we know that you have these big life events that make you more at risk of having urinary incontinence, like pregnancy, childbirth, or menopause, then if you have the accessibility and the means to see a women's health physiotherapist, they play a massive role in prevention.
So to go and see a women's health physio, is this something that you need a referral for?
No. So women's health physiotherapists are called primary practitioners, and what that means is you can walk off the street and see them without needing a referral, but you can have a referral to a physiotherapist if you would like to access a Medicare rebate to see a physiotherapist. Likewise, if you don't have the funds to see a physiotherapist, you could get a referral from your GP and get referred to the public hospital. So you could see a publicly funded physiotherapist. Wait times will vary depending on where you live in the country. And obviously, how, the type of physio you see and how often you see that physio is going to change. But yes, you don't need a referral.
So I'd like to hear some good news that with some practice and advice, you can remedy this situation and effectively live the rest of your life without having this problem.
Yes, I can definitely give you good news there. So I guess I already said that there's lots of reasons why you might leak urine. There are lots of different types of urine leakage. So if you're leaking urine, you might be leaking urine because the physical stress on the bladder outweighs the closing pressure at the exit of the bladder. And so you leak urine. They call that stress urinary incontinence. And that might be when you cough, sneeze, laugh, jump, the things we've already spoken about. That's the most common type of urinary incontinence. Then you also might experience what we call urge urinary incontinence. And that's when you leak urine, when you're busting to go to the toilet, or when you just feel like you need to wee and you're walking to the toilet and you don't make it in time. And then we have the third most common being mixed urinary incontinence, which is where you experience both of those things. So depending on the type of incontinence you're experiencing and the reasons you're experiencing that incontinence, that's going to impact how we treat you. So I think that's one of the most important things to make a listener aware of, is that you might Google urinary incontinence and how to fix it, and there might be lots of things that pop up. The treatment that is most appropriate for you is going to be one that's based on an assessment and what's causing urine incontinence. But if we talk about managing bladder leaks and what the stages are, I liken it when I talk to my patients like a staircase. You don't start on step 10, you start on step 1, step 2, step 3, and you work your way up. In terms of managing bladder leaks, step 10 is surgery. So there is surgery available, and there are many different types of surgery available to help treat bladder leaks. But they come with lots of risk, and not all of them are as successful as what we call conservative management, which is our first step. It's the lowest hanging fruit. It's the easiest to implement with the least risk and the least cost to the patient or the person. And conservative management for treating bladder leaks looks like pelvic floor muscle training. So exercises for your pelvic floor to strengthen those. And we can get into that a little bit later if you want the ins and outs of how to do it. But it's lifestyle changes. It's looking at your bladder and bowel habits, and this forms conservative management. And if we look at, you want the good news, can it be fixed? Conservative management strategies, when implemented by a therapist, more specifically a women's health physio, and done for at least 12 weeks in a supervised way, have the ability to cure or improve more than 75% of women experiencing bladder leakage.
That's good news. Thank you.
Yeah.
Let's talk about some of the lifestyle habits that you just mentioned earlier that can contribute to this problem.
A big risk factor is constipation. And so one of the first lifestyle hacks, I say that in inverted commas, but one of the first things you can do to help improve your bladder health is to improve your bowel health first, especially if you're experiencing urge urinary incontinence or stress urinary incontinence. A full bowel is going to massively impact how likely you are to leak when you cough, sneeze, and laugh, or how urgent you feel the need to do a wee. So it's a test I give all my patients, and I have a saying in my clinic that everybody is constipated until proven otherwise, because everybody tells me they're not constipated, and everybody has usually got pretty crappy bowel habits. And so we might say, talk to your GP, particularly if I'm not seeing them face to face, but talk to your GP about managing strategies to manage your constipation quickly. But in my clinic, if I'm seeing my patient and I know that it's a safe option, I'd put them on a stool softener, something like Movicol or Osmolax, and I get them to take it every day for 2 weeks and then reassess how much they leak when they do the same activity like cough, sneeze, laugh, or jump. And surprisingly, for a small population of people, that's all they have to do.
Wow.
And urinary incontinence goes away.
So when you say most people have crappy bowel habits, what is a good bowel habit?
So the actual statistic, the diagnostic statistical manual that says, do you have constipation or not, states that you have to have, chronic not going to the toilet every day for a long period of time, but you might open your bowels everywhere between 3 times a day to once a week, and that's considered normal. In my field of work, if you have urinary incontinence, I would be wanting you to do a poo every day. And it should be easy to pass, soft and squishy like a banana, and you should be able to empty your bowels and feel completely empty within 5 minutes of sitting down onto the toilet. So if you're not doing that, then we want to look at strategies to help you improve that. That might be optimizing your position on the toilet. That might be optimizing your ability for your pelvic floor muscles and your anal sphincter to open and relax when you do a poo. It might be learning how to correctly breathe rather than force or bear down into your pelvic floor when you do try to empty your bowels. And then looking at your diet, what goes into your mouth, and your fluid intake that might impact the stool consistency, because that's going to be a big one.
Yeah, diet obviously plays a big role in this, but also, as you say, so does fluid. And one of the things that also happens is this need to get up in the middle of the night more frequently as well, which I know from girlfriends is like, well, I try not to drink too much fluid after 4 o'clock in the afternoon, which gets pretty, has its own problems.
It's so challenging. And, we're talking about all of the changes that occur with menopause anyway. You're experiencing a lot of symptoms that do happen at night and a lot of insomnia anyway. Add to that needing to do a wee, and it can be an extremely stressful time for a lot of my patients, incredibly stressful. And, if we, as a physiotherapist, if I can take one of those stresses off the plate, being bladder leakage or the need to do a wee all the time, then that can hopefully help improve somebody's quality of life and their stress.
We'll be right back after this.
Perimenopause can actually start in your 40s. Declining estrogen production during perimenopause brings on changes to menstrual cycles and often the onset of hot flushes, night sweats, mood swings, and sexual problems. Promensal Peri is specifically designed for perimenopausal women and can help relieve these common menopausal symptoms. Promensal Peri is available at leading pharmacies across Australia and offers a cost-effective treatment at under $1 a day. When things start to change, try Promensal Peri. Always read the label and follow the directions for use.
Okay, we're back. Okay, well, let's get on to some of the myths around bladder leakage. What are some of the things that people come to you with completely wrong ideas around?
Oh, I love this question. So many. The first is around fluid intake. I think I see a lot of patients that come to me, particularly patients that are leaking urine, and they have done for many years, and now they're in this midlife, this 40s or 50s, and they're experiencing this urgency, this frequent need to wee associated with leaking, maybe when they do activity or maybe on the way to the toilet. And they're either significantly restricting their fluid intake because they're scared of leaking, and they think, I'm just going to cut out drinking altogether, and then I can't leak, surely, or I can't feel the need to do a wee all the time if I've significantly cut out fluid. But just like overconsumption can make bladder leakage worse, so can underconsumption of fluids. So the main reason being constipation, so it's going to impact your constipation, which is then going to impact your bladder. But also, the bladder, we talked about being a muscle. The bladder requires a certain amount of stretch on it to be able to empty completely. And also so that the messaging to the brain in terms of how full it is, those messages are consistent and regular, or I say normal, and I use that term loosely, but normal for the sake of a better word. And if we're chronically underhydrated and we have small amounts of urine in the bladder, can actually make it harder for our brain to understand if we do need to do a wee. And when we do a wee and we have small amounts in it, can actually make it harder for the bladder to completely empty. So you always chronically get this small amount left in the bladder, which is then going to trigger your urgency again, and you end up in this vicious cycle. So under-consuming fluid is a big myth that I see in my industry. I think also another myth is around Kegels or pelvic floor exercises, and we touched on this before, but a lot of women come to me saying, I've tried pelvic floor exercises, I've done them, they didn't work. And then I delve into that a little bit more, and I find out that they've been told just to squeeze as strongly as you can, as often as you can. Oh, you can do it at the lights. You can do it when you're making a cup of tea, It's that easy. And the truth is pelvic floor exercises are hard. They require a lot of mental imagery and motor control and planning. And I don't know yourself if you've been taught them before or how you feel about them and what your experience with them is, but it's not easy.
Well, I've got to say, when you're saying that, I'm thinking maybe I have learnt to do them wrong. So let's talk about how to do them properly.
Yeah, I think I start the conversation around this type of muscle training thinking about other muscle groups. And I think when you think of the pelvic floor as a muscle group, like a muscle group you're used to seeing worked out or that you're used to working out, it sort of makes sense why we need to have a little bit of a change around how we think about pelvic floor muscle training. Because if I was to say, get up here, and if this was a video podcast or if it's an audio session, so I'm teaching you how to do a squat, I'd stand in front of you as a personal trainer. I'd point to the glutes and the muscles at the front of your legs and the back of your legs. And I say, these are the muscles that we're working. And this is how you perform the squat. You place your legs shoulder width apart. You sit down like you're about to sit on a chair, or depending on the type of squat we're teaching. But you could get visual feedback of what you're doing and what I'm doing just by looking over or down at your legs or looking in a mirror. And it's quite easy to get feedback that way. The same doesn't go for the pelvic floor, because you can't see it, in a setting like this where we're fully dressed. It's difficult to get feedback if you're doing the right thing. So it requires a lot of mental rehearsal, a lot of good, what we call in the physio world, proprioception. And proprioception refers to our body's ability to understand where it is in space. So if you're squeezing your pelvic floor and it's on, we want you to have good proprioceptive awareness that that muscle is on. And if you've relaxed and switched it off, we want you to have good awareness that it's relaxed and switched off. But just like another muscle, we need it to be strong, yes, but we also need it to be able to relax and lengthen. And we need to do these things at the right time. So that's called coordination. So 3 things that good pelvic floor muscle training should do: should target strength, length, and coordination. So it's more than just squishing that muscle or squeezing that muscle on. And then if we're going to train it in a way that builds muscle change physically, so we actually see hypertrophy of this muscle, so it gets stronger and it's more coordinated, well, it needs to be done in a way that is going to give enough dosage to get a response. And that happens through sets and reps that are done close together with a rest period. So you might be doing 3 sets of these exercises once a day and then not doing them again, or you might be doing a few sets of multiple different exercises 4 times a week, as an example, just like you would if you were doing squats and going to the gym.
Okay, so can I come back to your second point there, which is knowing when you're turning on the right thing because you can't see it.
Yeah.
So are there any clues that you can give us?
Yes, definitely. So the first thing is to understand where the pelvic floor is, because it's actually a group of these muscles and it runs from your pubic bone at the front of your pelvis round to your tailbone at the back, and then slings between your left and right sit bones, almost like this diamond at the base of your pelvis. And, as the name suggests, the floor of the pelvis. And these muscles on top sit your bladder at the front, your vagina in the middle, and your anus at the back. So already having a think about what organs that you do have sensory awareness over, where they sit on top of the pelvic floor, can give you some clues about how we would cue or think about the pelvic floor in order to get the right contraction or squeeze and relax, if that makes sense. So we can actually, when we think about the pelvic floor working, we can think about a cue that uses the front passage, so your bladder and urethra. You can think about tightening as if you're trying to stop the flow of urine, which is the most common cue that women would have probably been told by their GPs or on a pamphlet. But similarly, if we think about the pelvic floor at the back, that the bowel sits on top of it and the anus exits through the external anal sphincter, which forms part of the pelvic floor. So you can think about squeezing as if you're trying to hold wind. And we know in the research, if I have 100 women in front of me and I give different cues, most women do the right thing if I give them a back passage cue. So if I say squeeze around the anus as if you're trying to hold wind, or imagine picking up a marble with that muscle, you should notice a tightening and a gentle lift up inside of you. And when you relax and let go, you should feel that muscle drop and expand. And just by thinking about that, if you have within yourself confidence that you feel a squeeze, a tightening and a lift and a drop and relax, that sense that you have that is actually good. And that we know that in research that it's likely you're doing the right thing. But if you wanted some strategies to help give you feedback, you could get tactile feedback from your hand. So you could place a clean finger in the shower at the entrance. Don't have to stick it inside, just at the entrance to your anus. Or over your perineum, which is the space in the skin between your vagina and anus, and you could see and feel what happens underneath your finger. you should feel a gentle tightening of that muscle. And it shouldn't be your big bottom muscles. It shouldn't be breath hold or your stomach. It should just be isolated to that muscle. You could also get visual feedback by using a mirror, as if you were trying to watch yourself insert a tampon. And you could use that before you get in the shower and visualize what's happening at that space when you do these exercises. And what you should notice is that muscle tighten and pull up inside of you. Almost, we call it like an anal wink.
So how long do you hold this for? What's the optimal?
Yeah, it depends on who you are. It depends on what stage of life you're at and what you're trying to get out of pelvic floor muscle training and where your baseline sits. So if you come and see a physio and we assess you and we say, okay, your endurance, your physio might ask you to squeeze for as long as you can, and we're trying to see where you fatigue. Say you fatigue after 5 seconds, then your home exercise program would look at squeezing this muscle for 5 seconds repetitively to see if we can bump that number up closer to 30 seconds. So ideally, a healthy pelvic floor should be able to squeeze for 30 seconds without fatiguing. Okay, but anywhere between 10 and 30 seconds is quite good. And what you'd need to be able to do basic daily activities like lifting the groceries or running for the bus or, not quite jumping on the trampoline just yet. You might need a little bit more strength for that. But a really good holistic pelvic floor muscle training program should have a combination of longer holds, so around 10 to 30 seconds, but also quick squeezes, so squeezing quickly for 1 second and relaxing, and working on different aspects of muscle control, because yes, we need endurance of that muscle, but you also need that muscle to quickly and strongly turn on if you're about to sneeze, right? Doesn't matter if you can hold it for 30 seconds if you can't quickly turn that muscle on when you sneeze. So a holistic pelvic floor muscle training program would look at exercises that manipulate time and intensity of the squeeze. And I guess for anybody that's interested in, because if you're listening to this and you have never heard about pelvic floor muscle training more than just squeezing your pelvic floor, you might be thinking, oh gosh, I feel like I have been doing it wrong. I'm not sure where to start. Yes, what you're saying makes sense, but actually I just need to see it physically. I need to watch a video and I need somebody to talk me through this and what it actually looks like. If you'd like an insight into what that is, then I recently partnered with Poise, and if you go to poise.com.au, you can find access to a 12-week free pelvic floor muscle training program. And it's like being a fly on the wall in my clinic and seeing exactly what I would teach patients to do for 12 weeks.
Which brings me to my next point. As we're perhaps doing these exercises and trying to get our pelvic floor stronger, if we do have an issue with some accidents, what sort of protection is available to us?
Yeah, I think having the right protection is important if you are leaking, because yes, it's nice to say, oh, we could treat it and we could fix it. But there's going to be this period of time where we want you to still stay physically active, because I think the biggest long-term impact of urinary incontinence, in the short term, you have these increased risk of urinary tract infections, increased skin irritation, rashes, and all of those things you can reduce the risk of those short-term impacts by just managing it better. So making sure that the urine is absorbed away from the skin properly, and doing that with either a product like a Poise pad, either whether it's a liner or an actual pad. And if you're curious as to whether or not what product is what product is right for you based on the amount of leakage you're having, that website I just mentioned also has a quiz that asks you when you're leaking, how often you're leaking. It can best align you with the right product. But there are also reusable products, and a lot of my patients have used off-the-shelf menstrual products. And I say, please don't do that, because the product that absorbs blood is completely different to the product that's designed to absorb urine, because they're different viscosities. So making sure that you've got the right product for your incontinence is important to minimize those short-term issues, but also to improve your confidence to exercise, so that you can reduce the risk of the long-term issue, which in my opinion is that avoiding social situations, avoiding social activities, and avoiding physical activity because you're scared of leaking. But even if you leak, if you've had the right product, you might be more confident to exercise. Does that make sense?
It does make sense. And I guess I just want to say to our listeners, yes, that is a baby in the background. Caitlin has a 4-month-old that obviously has just woken up. So we'll continue. Everybody. Can you talk me through then, what are some of the more suitable products?
I know reusable is all the go at the moment. And it is nice because you don't have to continue to buy lots of different products. There's lots of reasons why reusable is going to be beneficial. But I think in terms of being user-friendly. So me personally, I've experienced stress urinary incontinence after the birth of my son, and reusable products. So, for example, the Poise reusable undies that are available at Coles and Woolworths, or you can buy them online, that are very similar to high-waisted menstrual undies, but they are designed to absorb urine, so bladder leaks, not just menstrual blood. And they have helped me return to sport, even though I'm leaking urine whilst I'm treating bladder leaks. They absorb the urine away from my skin quickly, so I know I'm not going to be at increased risk of the urinary tract infection, and the risk to rashes and, I guess, discomfort to my skin is low. And I just throw them in the wash with everything else. So unlike a menstrual product where you're supposed to rinse them and get all the blood out first and then pop them in the wash, which can be quite time consuming, you just throw these in with everything else.
That's good to know. We'll be right back after this. Okay, we're back. One final question, Caitlin, that in your practice where you see women that have these whoopsie moments, there's nothing more embarrassing than having something like this happen in the middle of a gym class or somewhere that others can see. I'm sure that you and your clients have come up with some pretty savvy quips or ways that people can elegantly manage that in a public situation.
I think the more that we are having this conversation that we're having right now, the more that my industry as a women's health physiotherapist can educate, say, the personal training and the group fitness industry, particularly an industry that's male dominated, the more that we can educate these professionals on just how common it is, and the more that this conversation is being had, the less that it would have to be embarrassing, if that makes sense. It's always going to be embarrassing, right? It's always going to be a sense of, I didn't want this to happen. This is awkward. This has happened. But if the conversation is happening more and we have more women say, hands up, me too, it's going to feel less, it's less of a burden to that person. But also if your personal trainer or a group fitness instructor is aware that this is common, they might just be able to say, oh, hey, I have an awesome physio down the road. Her name's Caitlin. She deals with this all the time. Do you want to go have a chat to her?
Really good advice. Thanks so much for joining us today, Caitlin. That's all we have time for. Listeners, thanks for joining us. You can follow Caitlin on social media at The Pelvic Floor Project. And don't forget, for more information about living your best life at midlife, pick up a copy of Prevention Magazine. I'm Andrea Duval, and I'll see you next time.